Not into long podcasts, don't worry. We've got bite sized clips just for you. This is CWN Clips. Please don't forget to subscribe. All right. I think the next question on the SNAPED funding. I think this was an interesting. I know even the Ken Cook and Marion Nestle in a conversation I was listening to, they talked about this in detail. But I think the Republican proposals threaten SNAPED funding, which is the 536 million annually, and aim to cut 300 billion from the main SNAP program. So that's a report which I looked at from my the articles I read and also research. So how this is counterproductive than helping the people who need snaps to have access to good food, right? So but while RFK Jr. is talking about reduced processed foods and probably oils, fluorides and whatnot, and even polluting the sea. So he's looking at lead. I mean, he talked about that. So there's a lot of things he's talking about in terms of what are the repercussions or probably having these part of our American health system. But then you're trying to stop the funding for a SNAPED program, which gives the flexibility for you know people who are not able to afford to go and buy healthy options. So how do you think this is?
Yeah. It's the SNAP Ed component of the SNAP program is only a small part of it, and
Mm,
it's it's a component that attempts to give SNAP
mm,
benefit recipients, better information about the kind of food they should eat. It's not a requirement. They don't have to do anything, and those that receive the SNAP Ed benefit may or may not make healthier choices. It's not been clearly established that SNAP Ed is a powerful lever for
mm.
improving diets. The SNAP program overall, it's called the Supplemental Nutrition Assistance Program. And the way it functions is primarily as uh, an income safety net for for poor families, for poor households. You're eligible to get the benefit if your household income falls below a certain level. So it functions a little bit like the old welfare programs used to function. Um, they were cash assistance to poor people. The SNAP program is a food purchase credit given to poor people
Right.
that allows them to save money on their food purchases that they can then use for other things. So it's a little bit like it's an income support program that's operated through food purchases. And in the United States, where welfare isn't popular, where Congress won't vote for straight cash payments to poor households, they will vote for uh, a food voucher guarantee because it's feeding people.
Right.
And
Right.
it's hard to vote against that. And also, farmers like that because well, you're increasing the quantity of food that people eat, supposedly through this program, which means people who grow food have a bigger market to sell into. But it's not a particularly effective way to improve dietary health because you're not restricted in the SNAP program on the foods that you can purchase with the benefit. You can purchase healthy foods, but you can also purchase sugary beverages and
Yes, there's no
canned.
restriction. Yeah.
Yeah. You can purchase foods that are not particularly good for you. So I support the SNAP program, strongly support the SNAP program as income support for poor households. It's one of the very few entitlement programs that the federal government offers that is effectively targeted toward those in genuine need,
Need.
as opposed to Social Security, which goes to rich people as well as poor people, or as opposed to Medicare, which goes to rich people as well as poor people. Here is finally an entitlement program that's targeted toward low-income communities. So I'm in favor of it that way, but it's a weak instrument for shaping the health of diets in America, in part because most of us with unhealthy diets don't participate in the SNAP program. We just go to the supermarket and use our own money to buy unhealthy food.
Yeah, I think we dig our own grave. That's true. Thanks for watching this highlights from CWN Clips. If you want to dive deeper, the full episode is linked below.